Hello, this is Dr. Nazare coming to talk to you again. And today I am going to talk to you to add to my last video because the last video was talking about a rather complex problem. So today I wanted to explain it a little better and expand on it and also give you an example because I think that would make it a little clearer what it is that I'm talking about, and therefore hopefully it'll be more helpful to you. So as I was talking to you the last time, I was referring to the problem that some people have, and that what we notice is that they don't seem to be able to protect themselves very well, if at all, when somebody is treating them poorly, maltreating them, or even abusing them. At this moment, I'm only talking about emotional, verbal abuse, but this can also add all the way to physical, of course. But at the moment, I'm just talking about what we encounter more often, which is somebody who's being maltreated and essentially emotionally or verbally abused. And the particular is that we become aware that this person doesn't seem to be able to protect themselves. So as I said the last time, there are two factors that we can notice or that are part of it. And one factor is that people with this problem that I'm discussing again today don't seem to be very able or very clear in apprehending or noticing when somebody is treating them in a way that's wrong. They don't seem to be very aware of it. So that's factor one. And factor two is that when it happens, they don't seem to have the appropriate response that most of us would expect. And just to let you know, the appropriate response for any of us humans when we're being treated poorly is that we have a natural reaction of anger. And healthy anger simply tries to protect ourselves by asking the person to stop or to move away or to in any way interrupt whatever they're doing that is the poor behavior. So I wanted to add, again from the last time I talked about this subject, that these two factors, one being that the person doesn't seem to be very aware that the treatment they're receiving is wrong and poor, and also they're not able to protect, that it's not always the case that people have the two factors. So sometimes they may only have more of one or more of the other, but I'm talking about today about the people who actually have both. And what we are most likely to notice is that they don't seem to know how to protect themselves. So I am going to today give you an example of a case of this sort. But before that, I wanted to reiterate that one of the particulars of people who have this problem is that when there are friends or a family member or somebody that we care about, it could be a coworker, could be anybody really in our social realm, we tend to have a desire to help them because we ourselves notice that this is not the right way to be treated. And most of us, unless you're a sociopath, are evoked into wanting to help. So one of the particulars that I wanted to reiterate and underline is that part of what's a little weird to us is that when we offer advice, guidance, ideas, ways of relating to that person who's treating them poorly, they don't appear to be able to take that advice and that guidance into action. So they may, as we're talking to them and they're telling us about a problem or we've seen the problem, as we're talking to them about solutions or even telling them how wrong this is, they seem to be in agreement with us, they're receiving our information, they're well with us, everything seems to be flowing. But later we find out, either because we see it again or because they tell us about another incident, that for whatever reason, unbeknownst to us, they were not able to implement any of the ideas or suggestions that we came up with. So those are the particulars, right? So what I'm going to do today now is give you an example of such a situation. So I'm going to be talking to you about a recent case of mine, a patient of mine, who suffers from this. So the situation was that she had recently suffered a loss, and this loss was the result of her best friend losing a young child. So the child suddenly died. And her friend was her closest friend, and she knew the young child. So my patient was telling me about her own suffering about this event, but she was also telling me that she was really having tremendous amount of pain and suffering because she worked in a situation where a lot of people knew this other person, her friend, and the people would ask her about her friend, and the people would ask her, different people, all kinds of people would ask her what happened, and they would ask her how the friend was doing, and so she had become kind of the go-between. People were not that comfortable talking to the mother of the child that died, so they were coming to her because they knew that this was her best friend. So what was happening is that as these people were asking her these questions, my patient was telling me not only was she suffering from the horrible loss and from her friend being in such grief, but she was also suffering because so many people were asking her about it, and she had to answer, and she kept answering all these people. And she told me that at various times she really was at the verge of tears and she wanted to cry, but she would go and move to the bathroom, go to the bathroom and cry there because she was trying to stop her tears. So I'll talk about that in a minute, about this idea of why would somebody want to repress their tears, because that's important too. But for now, I just wanted to tell you that when she told me this, I began to imagine that this problem that I'm talking to you about was the problem that she was suffering from. So first I asked her why it is that she couldn't tell people that she didn't want to talk about it. And she felt very bad about telling anybody that she didn't want to talk about it because, number one, she felt that they needed this and they wanted this. And number two, she really didn't know how to do this, and she thought they might get upset, or they may get angry, or they may get disappointed with her. So these situations, these emotional possibilities, made her unable to stop these people from asking her. So that is the second factor that I've talked about this at the beginning of this video and last time, which is when a person is unable to protect themselves from something that is injuring them, right? So that is one factor that was happening to her. And so I imagine that this is a person with the dynamic that is my insight, which is that probably this is somebody who endured very bad treatment growing up and who became very accustomed to people doing things to her, saying things to her, treating her in certain ways that were very painful, that hurtful, and that she didn't have the right to say anything about it. So remember, I was talking about enduring. So this is somebody who grew up in an environment with a lot of abuse, a lot of maltreatment. So she tends to not notice when bad treatment is happening, not notice in terms of having a name for it. It's not that the person doesn't notice, by the way. The person does feel bad, and they may feel really distressed inside, and they may even feel like very dysregulated, like they can't handle it anymore. But they don't think that what is happening is because of what the other person's doing. They don't recognize that what's happening is coming from outside. And the other thing, of course, is that they don't think that they can stop it because they don't know that they have a right to stop it. So the first thing I did with her is tell her this insight of mine and ask her how much she had to endure growing up, which in fact she had to endure her entire life. And then secondly, what happened when she did in fact protest at any time during her development. And of course, what happened to her is she would get hit, she would be blamed, she would be in one way or another told that she was wrong and that she was bad. So this is an example of that situation. So what I was helping her with is asking her if anybody had told her what she could do in this situation, because this had been going on for 2 weeks. And she told me that her husband had talked to her and had told her to tell the people to not ask her this, that, to stop having people ask her. and that in fact she wasn't able to do this. So she not only was not able to have these people not continue to ask her, but she also ended up in trouble with her husband because her husband was getting upset and frustrated because she was coming home in really bad shape every day from work. And so he was getting frustrated with her. So this is a case in point. So what I did is, first of all, ask a little bit more about how she grew up, which I knew already a little bit, and the need to endure, and then tell her, or rather ask her, if she was able to implement these ideas that her husband was telling her. And she said that she completely agreed with it. She completely realized that that was the right thing to do, but she just could not bring herself to do it. So this is an example of exactly what I'm talking about. So then what I did was explain to her that how this came to be, that she had to endure maltreatment her entire childhood, and that what happens in those cases is that we are not very, we don't recognize maltreatment. Why? Because it's so normal. It's been so normal for us to be maltreated that we don't recognize this is actually wrong. We also, in order to have this problem, we also have to have had no one intervene. We also need to have had no other adult or older brother or whatever tell this growing child, my patient, that what the mother or the father or whomever is doing is wrong. So they didn't get any validation that what is happening to them is wrong. As a result, they cannot recognize that this is wrong. They feel badly. I really want to emphasize that. They feel awful inside, but they don't know that this is because something is going on wrong. So we talked about that, and then we talked about what would she be able to do. And I asked her a couple of questions. Could she tell them she couldn't talk about it? And she felt like she couldn't do that because they would feel bad. And so what I did is begin to ask her, what is the little bit that she could do? And I asked her, do you think you could say that this conversation is making you feel uncomfortable, that it's difficult for you? So these possibilities, that it's making her feel uncomfortable, or that it's difficult for her, or that she could tell these people who are asking her that it's actually hurting her. And I explained to her that to say to someone that it's hurting would have to be done only with people who are known to her to be empathic and kind. Because if we tell people who are not empathic and kind that we're being hurt, they may not care. So it's not actually wise to tell anybody what you're saying is hurting me. That is good to say to people that you already know tend to be kind and caring. But for those other people that you don't know or you don't think they're going to be, it's best to say this is difficult or this is uncomfortable for me. And so I'm going to have to stop talking about this for now. And I added that it's important to say for now, because the reality is that at another time, later in time, another moment, she might be able to talk about it, but just for now. So guiding her into what she could do, giving her specific language, and constantly asking her if she could do it or not is the way to help somebody like this. Oftentimes, friends, and I'm afraid that also therapists and psychiatrists, oftentimes recommend to the person what they can say and do, but they don't ask them, which I always do, can you do this? And so they just assume that by giving advice, the person is going to be able to do this. So I want you all to know that if the person suffers from the problem I'm talking about, which is one where they've had to endure maltreatment, and they were rejected and belittled and humiliated when they protested, they also don't know how to naturally and healthily be angry and say, no, stop. So in these cases, you need to guide the person little by little in what it is that they could do. So I am glad to share with you, this actually just happened last week, and I'm glad to share with you that I talked to her this week, and she told me proudly that she had been able to implement what I had told her, which is really simple, like 8 or 5 or 9 times. And she was so proud, and I was so happy for her. And that's not a lot, but it was something enough to be able to tell people, please don't continue. Now, I did mention earlier that she had to be running to the bathroom at times because it was so painful that she was at the verge of tears. This I will elaborate on another day also, But this had to do, but I also think it's important for people to understand this, that when I asked her why she was suppressing her tears and why she couldn't cry, her answer was that she thought it was weak. So this notion that crying is weak is another injury that we receive in childhood. And this was making the situation worse because she couldn't express her natural emotions, which makes the situation even more stressful. So this is a little example of how this works. And I will be talking to you more about this. I just want to emphasize the aspects of it. And I want to emphasize the importance of asking questions of the person you're trying to help and of asking them what can they do and not assume that they're going to be able to do what we're talking about. So again, I hope this helps. And I will continue with other snippets about this problem and other things in the future. Have a wonderful day. See you soon.